Hello, I'm Sarah. I'm a cardiology research nurse.
And I'm Natalie, one of the burns and plastics research nurses. And we're standing in the grounds of Broomfield Hospital.
And this is where we come for our walk most lunchtimes.
We like to come here as and when we can to refresh our heads in between patients and just at lunchtime for a quick 10-minute walk.
Hello, my name is Richard Hughes. I'm in charge of grounds and gardens here at Broomfield Hospital. You can see behind me the sunken garden, which was originally a pond, which was part of the Edwardian house, and the owner of the house had the pond built. At the same time, she planted all these trees, which have got TPO orders on them. So the sunken garden dates back a long time. A couple of years ago, we actually got a grant from Tesco's for £8,000, and we created the sunken garden as it is now.
So we're standing here in the sunken garden now, and it's a really beautiful place to sit. I've often seen patients and their families when they're here to visit sat in the garden, and it's a beautiful view out of the windows of the offices.
So we're really fortunate here at Broomfield to have all this space, which is really like a park in the summer. We've had meetings out here, lunches, and it's just a really nice safe place to come in, sit and reflect and improve your mental health where you can.
Hi, my name's Joanne Smith and I'm the Health and Wellbeing Strategic Lead for Lancashire and South Cumbria Foundation Trust. I'm here today at Guild Lodge as part of the NHS Forest Project. I am passionate about the prevention of ill health. My background is public health, and it's so important that we look after our staff. So the jobs that people do here are quite challenging, so it's been fantastic for them to understand the benefits of having green space, flowers, wildlife all around the place. We would say really Guild is wrapped in natural beauty, and it gives everybody here a lovely space to breathe when they can get out and enjoy the fresh air. We're going to go down to the allotment site in a moment and talk to some people that work there and have been involved.
So can you tell us what it is you like about being here?
I've just been on mat leave and I've just come back, and the green space is amazing. It's great for well-being, it's great for yourself. You can just get carried away here all day. It's great, the space is brilliant.
It was fantastic because I've been working from home, to just get away from the laptop, come out into fresh air.
It's coming down here, the stresses seem to melt away with the day, especially with the situation at the moment. It's an area where you can come away from the sounds and stresses of everyday life. You can hear the birds singing, you often see all sorts of wildlife.
So I'm really conscious of my own mental health, and I just call this my happy place.
It's really apparent now, especially during lockdown, how open spaces really help you in terms of mental well-being.
What I like about here is the fact that we've been given this plot of land, which you can see here, with which we, as a community, we can use and grow our own food.
I really enjoy coming up here. It gives me a lot of mental well-being and enjoyment.
Being down here for me is a time out, not just from the courtroom but from other things that's going on around all the time.
And the benefits of horticulture and green space in lifting your spirits, lifting your mood and promoting mental health.
Excited about the work that we've been doing around green space. We are very privileged to have a beautiful environment at Guild Lodge.
And it's good for mental health because you get out into the greenery and things, you plant loads of trees. And
for me, from a personal point of view, it's been fantastic this year to see all the benefit that staff have got from the project, especially with the biggest barrier being the COVID-19. And
I hope this video clip has shown you how passionate we are about the green space that we've got here at Guild. You've heard from staff, service users, you've seen the space that we've got here. We really do have a positive culture around how greenery and green space supports our well-being. Thank you.
I'm Ginny Abubakar and I'm the Community Engagement Manager at Mount Vernon Cancer Centre, a specialist cancer centre in Middlesex. We employ in the region of 500 staff. The hospital itself was originally built as a TB sanatorium. Its elevated site, just outside London, was chosen and designed to offer fresh air treatment for its patients. The clock tower has been a recognisable symbol for the centre for a long time, and this lawned area is well known and well loved by staff. Many long-serving members of staff remember open days and social events being held here. In warmer weather, this area is well used for staff lunch breaks, with much of the existing seating and lawn area well used. Some staff also take the opportunity to use this route rather than walking through the hospital during the course of their working day. Following extensive engagement with staff, an idea to establish a circular green walking route consistently emerged as a priority. Organised group lunchtime walks that circled the whole site received negative feedback from staff: too much concrete and too many car parks. This area therefore presents an ideal location. We have an exciting opportunity to create a woodland walkway by making a mown path around the main lawn, with some meadow planting to enhance the route and clearing a marked path through woodland around the edge. The scheme includes signage and new and refurbished seating. Whilst the motivation for this project is staff health and wellbeing, there is of course an important opportunity to improve the patient's experience at the centre too. The plans have received overwhelmingly positive feedback from both patients and staff, and we are eager to realise the potential. The work with CSH over the last 12 months has really helped to inform how we can implement the project most effectively. It's been interesting to learn how the history of the site resonates and how we might use this to engage people with the space, for example. And it's been particularly helpful to learn from the experiences of the other two sites involved. We hope to emulate some of their successes by creating an organisational culture where accessing the outdoor space and walking during the working day do become part of staff's daily activity at work.